Welcome, everyone. Hello, and welcome to today's webinar event on the recently published Water and Health Report. Our speakers will provide an overview on the state of clean air in the United States and the most pressing health-related concerns. Speakers will also discuss upcoming advocacy opportunities that will be critical for nurses to engage in. Please remember to mute your microphones during the speaker presentations. And if you have any questions or comments, those can be added to the chat box. There will be a short Q&A session at the end, and speakers will make sure to address all questions in the follow-up email if there's not time to get to them all. We are offering 1 hour of nursing continuing education credit for attending the webinar today. In order to receive CE credit, attendees must complete an evaluation and receive 80% on the post-test. Information on how to complete the evaluation and post-test will be provided by email following the webinar. And currently, we do review these post-tests manually, so please allow 2 to 3 days after taking the test to receive your score and certificates. Again, welcome, and I'll hand it over to Katie.
Thank you, Hannah. And thank you everyone for joining us today. We're really excited to be releasing our new Clean Water and Health Report. It's an update to our 2017 report. And we think that there's lots of great information and ways that all of you can be engaged in this critical public health issue. And we are thrilled to have 2 speakers here with us today. Kara Cook, who was originally supposed to be on as well, is under the weather today. So you've got the 3 of us. So, and I'm Katie Huffling, the Executive Director for Annie. And then we also have Ann Hulick. And Ann is the Connecticut Director of Clean Water Action. And she focuses on passing health protective policies aimed at mitigating climate change by promoting energy efficiency and clean renewable energy, protecting our waters and reducing exposures to toxic chemicals. She's one of the awesome co-authors of this report and is also the co-chair of the Annie Policy and Advocacy Forum. And then we also have John Rumpler, and John is the Clean Water Program Director at Environment America, where he directs efforts to protect our rivers, lakes, streams, and drinking water. John's areas of expertise include lead and other toxic threats to drinking water, factory farms, and other sources of agribusiness pollution, algal blooms, fracking, and the Federal Clean Water Act. And John has been such an amazing ally. We've worked with him for a number of years, I think starting on fracking issues, I don't know, maybe 10 years ago. So we are thrilled to have him on today talking about the Clean Water Rule. So I'm going to be giving an overview of the report, and then Ann will be speaking about some of the issues and a little more in depth. And then John will be going over the Clean Water Rule as well as some of the lead issues in schools, because that's something that Environment America has been a real leader on addressing. And so let me just share my screen here. Oh, I don't think I did that right. Sorry. Technology. There we go. And so again, this is on our water and health, nursing opportunities for action. And also before I get started, I just wanted to say thank you to the Park Foundation, who provided funding to help us renew this report, as well as help us with coordinating activities for nurses around the country around clean water issues. And right now, there's so many opportunities, especially with new regulations and updates to regulations at the federal level, policies at the state and community level, as well as opportunities around the infrastructure bill and Build Back Better. And I just wanted to say thank you to all the co-authors, Kara Cook, Ann Hulick, and Sarah Brown Blake, for all of their hard work in drafting this new report. As I said earlier, it's an update of our 2017 report. And what we found in that initial report was that while nurses understand the clear links between clean water and health, many nurses don't have an understanding of the myriad of threats clean water faces here in the United States. And so when we looked to update this report, we felt like the first one, I think all of us, we saw so many issues. We threw everything in there. We just were like, oh, we have to include every single water issue. And it ended up being a really long report and maybe not as useful as it could have been. So with this report, we streamlined it and we give lots of recommendations on ways that nurses can be engaged. And also, one of my favorite parts of this new report is we interviewed a number of nurses around the country and provide case studies of either things that they're seeing in their communities or ways that they're being engaged in policy, whether it's within legislation or in their communities or in the healthcare institutions. So I think that there's really lots of inspiring stories related to nurses and clean water in the report. Water sanitation is considered one of the greatest public health achievements of the 20th century. And unfortunately, far too many people in the United States don't have access to clean, healthy water when they turn on their tap. Every year, it's estimated that the US healthcare system spends approximately $2.9 billion on waterborne illness, and millions of Americans every year are sickened by water contamination. Clean water is also essential to providing healthcare. And when you think of how many times as nurses, when you're taking care of patients, you wash your hands, and also just the amount of laundry that's done in a hospital every single day. Without clean water, we're not able to effectively do our jobs. And so, this is such a vital issue for nurses and healthcare in general. Right now, there are a myriad of opportunities for nurses to use their powerful voices to support strong federal regulations related to clean water. During the previous administration, much of what we were doing was trying to stop them from rolling back current regulations. And now we have an opportunity with the new administration to really strengthen a lot of these regulations. They're coming back and looking at these again and having nurses engaging with the EPA around these different regulations is such a great use of the strong nursing voice. John's going to be going in much greater detail about the Clean Water Rule, but other things that we talk about in the report include the Safe Drinking Water Act, which sets standards for drinking water. Threats to safe drinking water include things like lead and copper from pipes, bacteria from animal waste, algal blooms, chemical contamination from things like pesticides, hydraulic fracturing, and other sources. And we'll be describing emerging threats to our drinking water supplies, such as PFOS contamination, which is a threat being felt by many communities around the country right now. And the lead and copper rule was just revised in 2021, which was the first revision since it was enacted in 1991. We, along with health and other advocacy organizations, were disappointed that the revised rule left in place a non-health-based action level of 15 parts per billion for lead in drinking water, and it extended the time that utilities could take to replace lead service lines once high levels were found. Under the revised rule, it would take 33 years for systems to replace the service lines compared to 14 years under the previous rule. So we were a bit disappointed in that. However, over the summer, the EPA was holding listening sessions and looking at the revised rule. And one thing that we were really excited to participate in is Annie, along with several other nursing organizations, were able to participate in a roundtable and provide comments around our concerns related to the revised rule. Water infrastructure in the United States encompasses drinking water, wastewater, and stormwater systems. A 2015 study by the Natural Resources Defense Council found that more than 27 million people in the US are being served by water systems that have reported health-based violations under the Safe Drinking Water Act. So it's a serious issue. Many local treatment plants, especially those in poor or rural communities, aren't able to avoid the necessary updates to filter out contaminants. And this is another great area that nurses can be engaged, because under the new infrastructure bill, as well as if we can ever get Build Back Better passed, there will be funding that can go to communities to help upgrade water infrastructure. And so, we really want to make sure that those funds really focus on those communities that are most in need, and the communities that really don't have the funds to be upgrading their infrastructure themselves. Also in this section of the report, we hear from Nurse Felicia French, who's in Arizona in the Navajo Nation. She's amazing, and just talking about how the lack of water infrastructure has really impacted those living in the Navajo Nation. Many people there, they don't have access to clean running water, and they've had significant water contamination due to uranium mining. And so, the Native Americans living there have really felt the lack of water infrastructure, especially during COVID, where we've been, one of the first things that came out was washing your hands frequently. But what do you do if you don't have access to clean running water coming from your tap? Lead in water is the next section of the report. And as most of you probably know, there is no safe level of lead exposure, with exposure in children contributing to significant neurological and developmental harm. And it's estimated between 15 and 22 million people in the US are still served by community water systems that contain lead. I won't go into detail about this because both Anne and John will be mentioning lead in their remarks. But one of the things that we've been really pushing for, and we talk about in the report, is making sure that when lead service lines are being replaced, that they're not doing a partial replacement, so that both at the street level and then to the home, that the whole lead service line is being replaced in order to reduce people's exposure to lead. Climate change significantly impacts clean water in a number of ways, both too much water and too little water. So both flooding and drought conditions can increase the risk of waterborne illnesses. Climate-related water events also have a significant impact on water infrastructure. It's estimated that the necessary climate-related improvements to mitigate the worst impacts of climate change on our water supply will cost upwards of $944 billion through 2050. So, as we're looking at these infrastructure improvements, thinking about climate change as well is really a critical piece. The next section is on emerging contaminants, such as PFAS that Anne will be talking about, blue-green algae, which we're seeing more because of climate change and agricultural pollution, as well as something that we discovered as we were researching for this report around the coronavirus, in a way that we did not expect, in that some water treatment systems use liquid oxygen to decontaminate water, to disinfectant before at the treatment centers. And for example, in the Orlando area, they've been having issues because, as we know, COVID impacts the respiratory system, and the suppliers of liquid oxygen have been prioritizing sending it to hospitals and healthcare facilities and treating COVID patients. And so they haven't had the levels of liquid oxygen that they need for water treatment, and it's impacted the local water supplies and their ability to effectively treat water. So I just thought that was, sometimes we get these unexpected consequences. And then finally, water justice. While all communities are at risk of contaminated water systems, access to clean water and exposure to water pollution disproportionately impacts low income and communities of color. Early in COVID, I had been speaking with an environmental justice organization based in Utah, and they do a lot of work there on the Navajo Nation. And they were talking about how, again, this is a different Navajo Nation, but they have a similar issue to the nation in Arizona, and that a significant number of households don't have running water. And so what do you do during the pandemic when you're not supposed to be going outside, where they're saying to be washing your hands frequently? And some of the folks living there would have to drive 40 more miles or more one way to go get clean water. And so, it's a really significant justice issue. And so thinking about the communities that are most impacted by lack of clean water, many of those are lower income communities and communities of color. And then finally, we provide a number of recommendations related to health policy. And both Anne and John will be talking a bit about this, but there are so many opportunities right now for nurses to be raising our critical voice. We're the most trusted profession. And so, as you know, when we talk, leaders listen. And so using our voice and making that connection about how clean water is crucial to health and we can't do our jobs without it, I think is really important. Some of these recommendations, including strengthening policy and enforcement of water regulations, supporting funding and upgrades to water infrastructure across the country, reducing lead exposure in daycares and child care facilities, and addressing emerging contaminants like PFAS. And with that, I'm going to turn this over to Anne. Stop sharing.
Thanks so much, Katie. I'm just going to share my screen. Hold on. Okay. Great. Okay. 1 second. Oop. All right, I'm trying to get it to start from the beginning. There we go. Should. Okay, can everybody see that? Okay, sorry for that. Technology. So welcome everyone. I'm Anne Hulick, as Katie mentioned, and it's really an honor to be here with Katie today and John and my other colleagues at Annie, and of course, all of you. I'm just gonna dive a little bit deeper into the couple of impacts that Katie mentioned that are included in our report. And as Katie said, for this update, we really tried to narrow things down a little bit. We could do a whole, couple of days seminar on water quality, water issues. So we hope that this presentation just piques your interest a little bit and helps you understand how important it is for nurses and where we can engage, because there's a lot of opportunities and real need for nurses to speak up on these issues. And I, for one, have to admit, I kind of always took my water for granted. I turned on the water in my faucet or sink or shower or whatever, and I really did not think about it. Even when I was in hospitals all the time, just washing my hands all the time. But I really became concerned as I began to learn more and feel really compelled to have nurses raise their voice on water quality, because as you all know, is critical to our life. So I'm going to talk a little bit more about the impacts of climate change, because we're all seeing that. No matter where we are in the country, we're feeling the aspects of climate change and how we need to be thinking about how it's impacting water in our communities. And then I'll talk a little bit about the chemical concerns, and particularly PFAS, and then turn it over to John for what we can do. So Katie mentioned that climate change is water change, and she's absolutely right. And we are seeing, no matter where we live, the impacts of climate change, whether it is less frequent rain filling up our reservoirs and our groundwater aquifers. I know we've experienced that in the Northeast in the last couple of years, really unprecedented levels of drought. We're also in many parts of the country, particularly the West, experiencing extreme drought where water conservation impacts are essential and really impacting communities. As Katie mentioned, particularly Native American communities and others in rural communities that may not have access to clean drinking water systems. We expect that those changes will continue over the next years. And we're also seeing other impacts like more frequent intense storms. And what happens with those events is that we get a lot of rain all at once, but our ground may be either saturated and not able to absorb the water. And many of our paved and impervious pavements and driveways and parking lots, et cetera, have stormwater runoff flushing into our sewers and pipes that then contaminate, carry all those contaminants, all those chemicals, all those pollutants into our water systems. Many of these drain right into rivers that impact the quality of those water bodies. We're also seeing, as Katie mentioned, impacts to lakes and rivers with warming temperatures due to climate change, or more extended periods where we have warmer temperatures. This is being felt in areas across the country, and that clearly is exposing people to more toxic algal blooms, bacteria like cholera and other serious infections, dehydration, which is of particular concern to our vulnerable patients, children, the elderly, outdoor workers. So it is a real concern that we need to be thinking about when we're seeing patients in our hospitals, our clinics, in our communities. What are they dealing with on a regular basis? Are they swimming in water that may be contaminated? Are there sources that may be providing bacterial exposure that we need to be aware of and thinking about? We also know, nurses definitely know about lead, right? We know that no level of lead is safe, but we have an extensive lead problem in the United States. The EPA, our Environmental Protection Agency, estimates that there are 6 to 10 million lead service lines in the US. That may be a little bit of a conservative number. I know in my state, our Department of Public Health doesn't actually have an exact number of lead service lines. So again, just so everybody is aware, the lead service line is that portion of the water pipe that connects from the main pipe in the street to our homes. And when those get corroded from a variety of reasons, the alkalinity or acidity of the water, number of factors as they age, they can lead to lead exposure in our faucets and in our showers and things like that. In many communities, it is incumbent on the homeowner to replace that, or at least pay for a portion of that lead service line. So you can imagine that this has been a very inefficient way to fix this problem. And thus we are faced with a huge concern about more lead exposure with aging infrastructure and the like across the country. So as Katie mentioned, there's opportunities now with the infrastructure bill and Build Back Better to invest significant amounts of dollars to states and to our communities to clean up lead service lines, not at the cost of the homeowner, but by the state. So this is a real key issue that nurses can have a voice on And you all understand the importance. You see the health impacts of lead exposure. So this is a very widespread problem. It's not something of the past. It's not something isolated to Flint, Michigan. This is a huge deal. And I know John has been doing extraordinary work on this effort and will share more on this issue. So the other emerging contaminant that you may have heard of is PFAS, and PFAS is the acronym that is huge concern right now. And I'm glad that it's getting the attention that it is, but it is quite frightening. PFAS stands for per and polyfluoroalkyl substances. And they're a class of chemicals. I've heard varying amounts, over 5,000 different variations of these chemicals, but they all contain a unique trait in that they have a carbon-fluorine bond, which is the strongest chemical bond known to man. And that makes them very useful in many, many, many products, but it also makes them such that they don't break down in the environment. So once they're in products and those products end up in the environment or in our bodies, they don't go away. So they're used in a whole host of products. This is just a short list of what we're finding that they're in. So food packaging, the firefighting foam, anti-stain treatments to textiles and furniture and clothing, probably a lot in healthcare facilities where scrubs and textiles and things like that contain a barrier of PFAS to protect from stains and wetness. Non-stick cookware, as you all know probably from recent news reports, water-resistant outer gear and clothing, and even cosmetics, all use PFAS chemicals to make the products anti-stick, anti-stain, grease-resistant, and they're used in many industrial processes throughout the country. Even in old industries where they used these chemicals, we're still finding today chemical contamination from PFAS. So it is really important that we learn more about this class of chemicals and do all we can to get them out of products and out of our environment. Once PFAS chemicals, as I said, get into the environment, either through when we dispose of products, when they end up in the incinerator or in our landfills, when those products break down, these chemicals leach out and contaminate our air and water. It's estimated that PFAS contamination of drinking water or groundwater is prevalent in almost 1,400 sites in 49 states, as well as the District of Columbia. And the Environmental Working Group has done a great job of documenting this problem, researching this problem. And if you go on the site that I have here, you'll see an interactive map that identifies where all these sites are. And we're sure that they're going to be finding more as more and more testing goes on. The concern is that these chemicals are now found in not only in all of our bodies right now, because we've been exposed, they've been found in about drinking water supplies that affect about 110 million Americans. And again, that's probably a conservative estimate. So we have to, as nurses, really understand, I think that's the end, yeah. So I'm just gonna go back for a minute and talk just 1 second about the health concerns. So we do know that these chemicals are strongly linked to kidney and testicular cancers, to reproductive disorders, to thyroid and hormone disruption, actually, as well as immunosuppression and a whole host of other things. So we are very concerned about this class of chemicals and the ubiquitous nature of these, and the fact that once they're in the environment, there's really no effective way to clean them up. So we need to do all we can from a policy perspective to try to restrict the use of these chemicals in products. And there are opportunities now, both at the federal level and in many states across the country, to take action to restrict PFAS in products so that we are protecting public health as well as the health of our environment and further contamination. So I am excited about those opportunities. I think that this is a critical issue for nurses to engage in, and I look forward to working with my colleagues at Annie and John and others around the country to really make a big impact on PFAS contamination over the next couple of years. So with that, I will turn it over to John.
Great. Hey, everybody. That was an incredible whirlwind of bullet points and really great information. And for better or for worse, I don't have slides today, so you won't have to follow along with a lot of bullets, but I will have some links that I'll put in the chat for opportunities to take action and resources. I want to take us back to, well, first, let me just say a little bit about Environment America. Some of you, I think many of you know us as Katie mentioned, our organizations have worked together on a number of issues related to the intersection of clean water and public health, as well as other issues like climate and so forth. So terrific. You know, nurses are on the front lines every day and understand environmental public health, and that's why you're such critical partners and, frankly, honestly, much more credible voices on the public health impacts of these things than just an attorney like me. You know, nurses and other health professionals know the real deal. So I'm just thrilled to be here. Environment America, we're a national nonprofit advocacy organization with state affiliates in 29 states, from Maine to California, Florida to Oregon, most of the Great Lakes states except Indiana, I think. You know, we work on a wide range of issues. I run our clean water program. I'm based here in Boston, but we have a strong office in DC that works on federal policy as well. So that's just a little bit about us. But, you know, I just want to go back to what Katie was saying in the beginning about the connection between clean water and health, right? You know, we need water to be clean and safe for drinking, because we know that whatever we drink is going to go into our bodies. We need clean and safe water for fishing and swimming. As many of you probably know, there are millions of Americans every year who get sick because of bacteria, pathogens, and so forth in the water where they're swimming or otherwise recreating. You know, talk about mercury in our fish, another source of pollution. So that's a public health impact right there from water pollution. So all of these places where clean water and public health line up, you all understand that and see the importance then of protecting our rivers, lakes, and streams and bays as vital to protecting the health of patients and kids and vulnerable populations. And that's why this is so critical. So the thing I want to start talking about then is the Clean Water Act, and what does it mean for all these waterways that we care about that directly matter to our health. And then I'm going to shift over and talk a little bit about lead, which I know we've already heard about, especially these lead pipes in people's homes. What I want to talk about a little bit, I'm thinking maybe some of you are school nurses. I want to talk about lead in schools drinking water and what we can all do together to get the lead out at schools. But first, let's go back to the Clean Water Act. Again, our nation's bedrock environmental law with respect to clean water. The idea was 50 years ago, if you can believe it, Republicans and Democrats came together overwhelmingly in Congress and said, all of our waterways should be safe for swimming, should be safe for fishing, and should be safe sources of drinking water. That's just amazing. And we've made a little progress. We've made some progress, though we've got new threats emerging towards that goal. The Clean Water Act is an incredible tool, right? for the first time, set limits on how much pollution polluters could dump in our waters. And it even said we have a goal of ending the direct discharge of all pollutants into our waters by 1985. Yeah, we kind of missed that deadline, but it was a visionary goal, and there are lots of tools in the Clean Water Act to get us there. Limits on pollution, technology standards, something called effluent limitation guidelines. Don't worry, I don't think that's going to be on your quiz. That basically says EPA is supposed to take a look at new technology and say to polluting industries, hey, if you can reduce your pollution by another 15 or 20% next year, we're going to put that in your permit. That's going to be enforceable. So we're ratcheting down that pollution over time. Set up programs so that we can control wastewater, so we don't have sewage going into our rivers, lakes, and streams, which we still have today, billions of gallons of sewage overflows, as we heard about before, threatening people's health and so forth. But the tools are there for us to solve these problems. Here's another amazing thing about the Clean Water Act maybe you didn't know. A lot of us think, well, yeah, that's great that there's the Clean Water Act, but are these government agencies really going to go after these polluters? I mean, they're all in the tank, corruption, whatever, et cetera. Well, here's an amazing thing. The Clean Water Act says, if there's a polluter violating the law and the government doesn't go after them, citizens can go to court and sue these polluters ourselves. And we at Environment America have done that dozens of times. We've gone after Exxon, we've gone after Pilgrim's Pride, we've gone after polluters big and small across the country using the Clean Water Act when EPA or state officials fail to step in and enforce the law. So that's another amazing tool. I could go on and on for probably literally an hour or 3 hours about the amazing tools in the Clean Water Act, but the point I want to make is this. Those tools only help if the river, lake, or stream you care about is actually still protected by the Clean Water Act. Imagine if somebody told you that literally thousands of streams and millions of acres of wetlands across the country are no longer protected by this bedrock environmental law. That means if a polluter dumps into those streams or pave over those wetlands, like the oil and gas companies do when they want to build a pipeline, that sort of thing, there's nothing the federal government can do to stop them because the Clean Water Act no longer applies. That is the challenge we've been facing since 2001, when polluters began bringing a series of cases through the courts all the way up to the Supreme Court to chip away at the scope of the Clean Water Act and which waterways were actually impacted. And, it got to the point where there were, waters, there were streams that protected, that helped provide drinking water for up to 117 million Americans, and wetlands, millions of acres of wetlands that help filter out pollutants from the Great Lakes, from Puget Sound, from the Chesapeake Bay. Those were also at risk. And so many of us, including Annie and Clean Water Action and Environment America and many, many other groups, worked together to convince the Obama administration to restore those protections in 2015 in something we called the Clean Water Rule. Of course, when the Trump administration came in, one of the first things they did was ordered EPA to rescind that rule and replace it with something we've called the Dirty Water Rule. The Dirty Water Rule, as you can imagine by its title, actually takes away protection from many of those streams and wetlands, and actually takes away protection from even more wetlands and some other waterways as well. Once again, putting the drinking water for millions of Americans at risk, putting at risk our ecosystems that depend on these wetlands. I forgot to mention, speaking of climate change, wetlands not only filter out pollutants, they're actually nature's best protection against flooding, right? Wetlands can absorb like millions of gallons of storm water. So it's crazy that we would allow polluters of the oil and gas industry to pave over this amazing, terrific protection from our communities from flooding, which of course can be a public health hazard itself when toxic chemicals and sewage effluent are mixed in floodwaters that then go through people's neighborhoods. I mean, we've got a major public health problem there, as we've seen in Texas, Louisiana, and many other places. So again, another reason, just from a public health perspective, never mind the ecosystems, why we've got to make sure the Clean Water Act protects these streams for our drinking water and these wetlands and so forth. Well, here's where we are now. Where we are now is, of course, no longer have the Trump administration in office. The Biden administration's EPA is now reviewing the issue. A court threw out the dirty water rule and said, look, this thing's no good. It violates the law, as you might imagine. EPA is now going through a rulemaking to officially rescind the dirty water rule, because you can imagine the polluters are going to go to court and challenge that court decision overturning the dirty water rule. So until EPA actually formally takes it off the books, we're not safe from the dirty water rule. That's what's going on right now. There's a comment period that ends on February 7th. And in a minute or two, I'll put a link in the chat to where you can join us to tell EPA, along with thousands of others, you got to restore protections to these waterways. Now, there will be a second phase to this process, because rescinding the dirty water rule just gets rid of this really bad rule, right? What we then have to do is get EPA to take the next step, which is to restore protections to as many waterways as we can. And I say as many waterways as we can because maybe a few of you noticed that yesterday or earlier this week, the Supreme Court just decided to take a case brought by a right-wing legal foundation and a couple in, I think, Idaho called the Sacketts, that have been fighting this issue from the wrong side for literally decades, since 1986. And who knows what this Supreme Court will do with the issue. But right now, what we can do is push EPA to go as far as possible with a strong, legally defensible framework to protect as many waterways as we can. The first step there, again, will be to tell EPA, to provide support. So let me just put a couple of links here. I'm sorry if this is, somebody, Katie, you said a link to submit comments. That's great. I was just going to say, if you want to write your own comments, obviously that's the most powerful thing to do. If for some reason you don't have time to write your own comments, then this is the link to our petition on the clean water rule. On the dirty water rule. Sorry, typing and talking at the same time. Give me just a second here. Boom, there's the link. So as I say, again, if you have time to write your own comments in your own words, much more powerful. But if you're limited in time, we've got a handy petition you can sign. I know we have a limited time, so let me switch over then from the National Clean Water Act to the very local level of lead in schools drinking water. Now, the good news is there are not that many schools that have these terrible lead service lines that we've been talking about. A lot of childcare centers do, but most school buildings are too big to get their water through these relatively narrow lead service lines. So that's good. The bad news is most schools have extensive plumbing, solder, brass fittings, faucets, fountains, etc., that were made with lead. All the way up until 2014, the standards were far too lax in terms of how much lead was allowed to be in most of these things. And even after 2014, there's some testing showing that some faucets and fountains, at least, still have lead. So virtually every school in America, and our analysis of testing data from Arizona to Massachusetts to New Jersey to Texas to Oregon, shows widespread contamination of schools' drinking water. And of course, we're talking about our kids that are most vulnerable to the health impacts of lead in drinking water. Now, there are some things that maybe EPA can do to help address this issue. We can get into that later. But I want to just say there are things we can do right now at the local level. Historically, school districts have been strapped for cash. It's been very difficult to get them to spend resources on all kinds of public health matters. And that may still be true to some extent. But I got to tell you this, because of the federal COVID stimulus relief money, school districts are now getting $110 billion with a B, billion dollars across the country that they can spend on a wide range of things, including upgrading their facilities for healthy learning environments. It would take just a fraction of that money to put filters certified to remove lead on every faucet that is used for drinking water, to replace those old lead-bearing fountains with water bottle filling stations that also have those filters. And so what I'm going to do is we've created a toolkit that allows school nurses and parent activists and others to take action at the local level. Gives you all the facts, gives you all kinds of sample materials that you can use. And I'm just going to put that in the chat as a resource, our Get the Lead Out toolkit, that you can take action at the local level. And if you have any questions about that or need more information, definitely contact us. We'd love to work with you at the local level to help get the lead out in your school or your school district. But that's a great tool that we can use. I just want to flag one other thing, because the fight for clean water is ongoing. And you saw from Anne's presentation, myriad issues out there, right? Whether it's sewage or PFAS or factory farms or fracking or lead, as we just talked about, or the scope of the Clean Water Act itself, we're always going to need nurses ready to raise their voices for clean water one way or another at the federal level and beyond and beyond. And that's why what we did together with our national coalition, the Clean Water for All coalition that Annie is also a part of, is we created something called Voices for Clean Water. And it is basically just a microsite where we can show the broad range of people from all walks of life, mayors, doctors, business leaders, etc., that care about clean water. You know what's not enough represented in our 150 Voices for Clean Water? Nurses. We don't have enough nurses on the Voices for Clean Water microsite. And I think nurses are such a powerful voice for clean water. If any of you would like to join the Voices for Clean Water microsite, there's the microsite. And then I'm just going to put in the link, the sign up page that you can also use to join Voices for Clean Water. So here are four different, several different ways you can take action. You can send a comment letter or sign our petition on the dirty water rule to EPA by February 7th. You can download our toolkit to get the lead out in your local school or school district. And you can sign up to be a voice for clean water so that no matter what the issue is, PFAS or sewage or lead or whatever it is, you can be an evergreen warrior for defending public health and the water that we need for drinking and swimming and so forth every day. So that's what I got.
Awesome. Thank you so much, John. And thank you, Anne. You're both fabulous. A dream team working together here. Kara had pulled together some resources as well for submitting comments. And so I will, just because we're running out of time and I want to make sure we can get some of the questions that came in the chat answered. I will be sending those along. And we also, at that link that I shared too, Annie created some draft comments that you can tailor as you'd like from the nursing perspective. And we completely agree, just like what John said, if you have the time to tailor the comments and make them a little more individual, they definitely have more power. And your voice is extremely important during these comment periods. One of the things that groups like Environment America, Earth Justice, Natural Resources Defense Council that we work with all the time is if the EPA doesn't follow our comments or doesn't address them, then they can be used in court cases in support of strengthening regulations. So the nursing voice is very important during these comment periods. One of the first questions that came through was asking about water testing at home. You know, how can we do water testing for things like lead? They had stated too that they tried to get their reports from their local water company and that they are confusing. And it is true, they have to send you, if you're on a municipal water supply, they are required to send you a report every year. They only test for certain contaminants, and it is true that it can be very confusing to read. But John, you were stating that it can also be challenging to do testing on your own.
Yeah, that's, I mean, it can be done. And,
Mhm.
you know, we know this from the school's context. We know this, you know, people can take lead samples at home. I think the one thing I just want to comment on is all the experts tell us that lead sampling is highly variable. It depends on how long the water has been sitting in contact with lead, the temperature that day, vibrations, the pH of the water, et cetera, et cetera. And so you could take like 10 or 20 different samples on different days and get wildly different results. And so that's why we've been telling EPA, you know, stop this nonsense of relying on testing and only remediating the taps where this Russian roulette testing thing shows the lead turns up. Instead, we just got to get rid of these lead pipes. We got to put the filters on. You nurses know best that prevention is the key to public health, right? So let's stop with the diagnostics and testing, and let's do prevention up front and remove as much lead as we can from our homes and our schools and our childcare facilities. I understand that doesn't exactly answer your question, but it's just unfortunately just very difficult to reliably get an average about lead concentrations in water. That's just the chemistry of lead and water together.
Trying to scroll through the other questions here. One of the questions, and Anne, you might know this, are there any states that don't have PFAS contamination that you know of?
No. I think it's, you know, not every water system has been tested, obviously. So we don't know for sure. But again, according to the Environmental Working Group analysis that was done, it's been found in 49 states. We know it's all throughout Alaska. So it is highly unlikely that it won't be found. And the more that we start monitoring for PFAS, which we should, and that's going to take money, we should be monitoring for PFAS in our water and making sure that there's systems in place to filter out those chemicals. But it is likely that it is in our water systems and in water bodies. And we know from research, it's reported that it's in 99% of our bodies. We have to do all we can now to restrict further use of products that contain these chemicals and turn off the tap, many of us say, from these chemicals.
And I'll just put a plug in for our policy and advocacy forum call, which is next Thursday at 3 p.m. Eastern time. The Mind the Store campaign just came out with a report on PFAS in recreation gear, like coats and things like that, and trying to push retailers to get PFAS out of clothing. So they'll be on the call talking about that. So I think it should be a really good call. And also Janine, and this is also related to PFAS, she asked, how would one identify cosmetic ingredients that contain PFAS?
Oh, that's a tough one. There's no standard law that requires labeling and inclusion of all of the chemicals that are in cosmetics. So it's a real problem. We often don't know what's in these cosmetics. Research by the Environmental Working Group is also very helpful, as they've tested a number of cosmetics and keep a database of cosmetics and products that we all use oftentimes, and which ones might have PFAS in it or not. Some things that you might watch for are like PTFE or anything that says fluoro, but you can't rely on the label. Even pans or, I'm seeing some pans now that come out with PFOA free. You can't rely on that. That's just one chemical. That does not mean that there's not a whole nother variation of PFAS chemicals in that product. So don't rely on the labels. There are some efforts now at the federal level, and John, you may know about this too, to I think there's two proposals, one in the House and one in the Senate, looking to restrict PFAS in cosmetics, but it's unclear, how those will proceed. So it's tough.
I mean, certainly the FDA could take action as well.
Yeah.
If we could convince them to do that. There's also other EPA action pending on PFAS. One of the things we got to do is, it seems crazy that industries are actually still allowed to dump PFAS into our waterways. So one of the things we've done is called on EPA again to update those pollution control standards I was talking about under the Clean Water Act, to basically say, the technology is there, nobody should be dumping PFAS into our waterways anywhere. So that's another thing that there's no public comment period at the moment, but it's something that EPA is definitely thinking about, and we are pressing them to move forward with updating those pollution control standards later this year.
And also the National Academy of Medicine right now has a working group, which I know Dr. Laura Anderko, who's an ANI member, is part of, looking at health communication around PFAS. So that should be coming, their report should be coming out later this year. I think we have time for one more question. I think this might be one that John could answer. Are any states providing residents warnings and filters before water lines and service lines are disrupted?
Before they are, sorry, what was the last part of that?
So before they change out the water lines, are municipalities required to let residents know? Like, is there any reporting requirements?
I don't know that there's any across the board requirement, but it's a really good point that although these lead pipes need to be removed, when they are removed, well, two things. One is before they're removed, we should be providing people with filters. An example of where that's happening is Denver. In Denver, the water utility there, Denver Water, is saying to customers, if you have a lead service line, we will provide you a filter until we get a chance to replace it. So that's a great thing that they're doing. The second thing is when they go to replace the lead service line, there's a lot of disruption and rattling around and lead particles that get released. And so right after you replace a lead service line, there's going to be a lot of lead in the water in the very short term. And so households that are getting their lead service lines replaced should definitely have filters, for that period of time right after the lead service line is replaced. Is that what you were trying to get at?
I think that was great. I just wanted to again say thank you to Anne and John. This was fabulous. And it was great to see all the interaction from the audience here today. And just a reminder for everyone participating, we will be sending out all of these links for all of these things. And I'm sorry, I have construction and they just got back to work. They've been on lunch break. So we'll be sending out the links for everything. And if you would like continuing education credits, you need to fill out the evaluation and post-test. So we will be back in touch soon. And thank you all for joining us here today.